Hi, it's Bree and welcome back to PARC Parent Pointers. If you didn't check out my video from last week, we talked about how our office informs you of how many surgical procedures that your son may need to correct his hypospadias. This week and the weeks coming up are really important because we're chat about specific post-op instructions for each surgical procedure. This week is all about if your son was told he only needs one procedure to repair his hypospadias. So your kiddos had surgery. I'm sure you're wondering what's underneath those bandages, or what's underneath the diaper, and it is bandages. There's an inner white gauze bandage as well as this outer kind of like a sticker that's keeping all of it in place. It does have the catheter taped up towards his belly, and I'm sure the first thing that comes to your mind is how are we going to keep these on? So the catheter is taped up towards his belly, so urine is going to run down off the bandages. Just change his diaper like normal, clean everything up like normal, and that also goes for poopy diapers. So if you kind of have a little explosion, a little diarrhea, wipe up as much as you can, get it super cleaned up using a wet washcloth or like a Huggies kind of wet wipe. Anything like that is totally fine. We don't have any, or we have research that shows that there's no increased signs of infection if there's a little poop, and you just clean up as much as you can, get it all taken care of, and that's totally fine. Some kiddos, the bandages fall off the day of surgery. Sometimes it lasts for several days. At that point, you'll just want to put on Aquaphor. Make sure he's super comfortable putting Aquaphor either on the lid of the diaper. That way, it's going to be really raw and sensitive, so you don't want to completely, touch and all of that for now. So putting it on the lid of the diaper, or if you have the squeeze bottle Aquaphor, squirting it onto the surgery site. That way, everything is covered and moisturized. There's no such thing as too much Aquaphor. Goop it up. Make sure everything is really comfortable. Additional to that, I have parents ask me all the time if double diapering is necessary. It's not something that we recommend. Typically, we don't want you to go out of your way to buy those, but if you feel more comfortable having the double diaper, that's totally fine. Do whatever makes you feel comfortable to keep those bandages on. Additional to that, the catheter is going to be in for 7 days. This catheter is what's called a straight catheter. It doesn't have a balloon in it. It's not considered a Foley catheter. So it's held in by a stitch at the head of his penis. Because of that, we want you to wait until about day 5 giving a bath, because sometimes he'll pull it out or he might step on it, things like that. So we want to keep it in as long as possible. So day 5 for bath time, held in with a stitch at the head of his penis, and that will keep everything like normal. If your kiddo's a little bit older, I'm sure you're wondering maybe he's already potty trained. We typically have our patients put a diaper or pull it back on until they're until they're 7. At that point, we'll use a leg bag, but up until then, we want you to just use a pull-up. It makes it a lot easier. It's more comfortable for them, and it's a little bit easier on our parents as well. But if you have any specific questions in regards to your son or post-operative care for our one surgical procedure operation, then give me a call or shoot me an email. Otherwise, we'll see you next week. We're going to chat about the 2-stage operation, part 1 of 2 and 2 of 2, of course.